Good afternoon, ladies and gentlemen. I'd like to start by introducing myself. I'm Kelly Wilson. Today I'll be talking about a drug called Arthrexin. In this presentation I'll be going over some aspects of a drug called Arthrexin. The aspects that will be covered throughout the presentation will be the description of the drug Arthrexin, important drug facts, contraindications, interactions, complications and safety precautions, as well as the side effects. Also, I'll be discussing the 6 rights of safe medication administration that can be utilised when a health professional like a nurse administers the drug Arthrexin to a patient. Then I'll be finishing up with the conclusion, summing up the main points, and allow some time for any questions you may have about the drug and the presentation. So let's move ahead. Okay. First of all, what is Arthrexin? Arthrexin is a drug which is categorized as a Schedule 4 drug in Australia. This means that it can only be prescribed. The Arthrexin medications come as a capsule, which is shown in the bottom left corner. It is white. It is a white capsule with markers IN-25. The active ingredient in Arthrexin is endomethacin, 25 milligrams, which gives Arthrexin 25 milligrams. Alpha Pharm Property Limited manufactures the medication here in Australia. The medication has a half-life of 4.5 hours, and it can be taken either via oral, rectal, injection and topical. The medication is metabolized in the liver and is excreted through renal and fecal. Arthrexin is a type of anti-inflammatory drug that belongs to a group of medication described as non-steroidal anti-inflammatory drug, or NSAID for short. Arthrexin is used to help ease the pain and inflammation such as swelling, soreness and redness that may be caused by many conditions. Some of the conditions could be gout, period pain, arthritis, more specifically osteoarthritis or something similar to that. Can also help alleviate pain and swelling after setting a limb or joint. This type of medication can only alleviate the symptoms of pain and inflammation. It is unable to cure the condition. Arthrexin should not be taken if patients are hypersensitive to any component of the product or have an allergy to medication containing endomethacin or any agents of NSAIDs, such as, or for example, aspirin. Severe adverse reactions can occur if there is an allergy to aspirin or other NSAID medications, because Arthrexin can cause acute asthma attacks, rhinitis, as well as hide or create peptic ulcer in the gastrointestinal tract. When Arthrexin is used along with other NSAIDs, this increases the possible likelihood of gastrointestinal toxicity, as well as providing little or no increase of efficiency of producing the desired therapeutic effect. Due to this interaction with other NSAIDs, it is not recommended to use Arthrexin alongside or at the same time of other NSAID. Some types of medication and some types of medications may interfere with each other and cause adverse reactions. For example, aspirin has a decreased therapeutic effectiveness of Arthrexin. Warfarin can have an increased effect of the drug action. Diuretics can decrease therapeutic effectiveness, and digoxin could have increased half-life. These medications may be affected by Arthrexin and may also inhibit the efficiency of the drug in producing its desired therapeutic effect. Arthrexin is an exclusive inhibitor of cyclooxygenase 1 and 2. The enzymes that are involved in prostaglandin synthesis from arachidonic acid. Prostaglandins are hormone-like molecules normally present in the body, where they have a wide selection of effects, some of which lead to pain, fever, and inflammatory. The additional effects are outlined in box 2, which explains the analgesic and inflammatory properties. As with most medications, there are precautions that people must be aware of whilst taking their medications. Users of Arthrexin need to ensure they notify their doctor, dentist, pharmacist, and/or surgeon that they are using Arthrexin as there are associated risk factors that may be affected. In surgery, Arthrexin can interfere with the blood clotting factors, which may lead to bleeding or overclotting. Infection. Arthrexin can hide some of the symptoms of an infection, such as pain, fever, redness, and swelling. Blood tests can also be affected, as the Arthrexin may interfere with the results of the blood test, as it can give a false reading. Whilst on this medication, it is advisable that the person taking the medication doesn't operate any form of machinery or drive until they are fully aware of its effects on themselves before doing so. Some people may experience drowsiness, lightheadedness, hypertension, and quite possibly vision disorders. With just about any medications, there will be associated side effects. They can be serious, fatal, or harmless. In some cases, medical attention may be needed if the symptoms persist. Some of these symptoms could be headache, dizziness, lightheadedness, constipation, disorientation, drowsiness, and so on. Some of the symptoms can be counteracted with other medication while under consultation with the doctor, or quite simply take Arthrexin with food or any acid. Safe management of medication requires information of the drug and the reasons it has been prescribed. Knowledge of anatomy and physiology is especially important when medications are administered intramuscularly, subcutaneously, orally, rectally, or topically. Information of the drug and its consequences furthermore assist the safeguard against the administration, which could be fatal to the client. The component of a mistake is likelihood in all human activity. Mistakes in management of medicines can be grave, and because of the possibility of mistake, it's always a possibility. Special precautions are taken to help minimize the likelihood of a mistake occurring. One of the precautionary actions that can help an health professional to minimize the likelihood of a mistake occurring while administering medication is the 6 rights of medication administering. This is a method used by healthcare facilities to reduce and avert medication mistakes. When a medication is prescribed for a client, the nurse pursues the 6 rights to double-check safe medication management before providing the medication to the patient. This process can be repeated several times. The 6 rights are the right medication, the right patient, the right dose, the right time, the right route, and the right to refuse. Right medication the professional should check the right medication label, check the medication order or chart, and check for allergies. Right patient, at least use 2 identifiers. Confirm with the patient their identification, ask them to verbally state who they are, and check their identification details on the armband and their medication chart, as well as on the medication itself. Right dose, check the right medication chart for the right dose. Calculate the dose and double check with another nurse. Cross-reference the drug, look it up in the drug reference guide. Check the appropriateness of the drug. Right time, check the frequency of the drug order. Confirm when the drug was last administered. Double check administering time is at the right time. Right route, check the order and the appropriate route ordered. Confirm with patient that they are able to take the medication via the ordered route. And right to refuse. The patient has the right to refuse the medication. A nurse should ask the patient if they are able to take the medication, because this is the final step of safe medication administering. Here we are. We have a slide which gives us a basic, quick layout how we will use Arthrexin while utilising the 6 rights of medication administering principle. The flowchart lays out the 6 rights and fills in the gaps of what we will do and check, and gives us a graphical overview, a brief graphical overview. Some steps may be repeated 3 times before the medication is then given to the patient. Coming to the end of the presentation, to quickly sum up the overview of the presentation, Arthrexin is an analgesic and anti-inflammatory type of drug, has those properties. Some drugs that it can interfere with is aspirin, warfarin, and diuretics. It can also help alleviate symptoms from gout, period pain, arthritis, and as well as inflammation. One important note for this medication is to be aware of your allergies, with the medication. Be aware of your allergies to medication types. Some medications may interfere with others and cause adverse reactions. Yeah, this has been my presentation. hope you enjoy the presentation. And if you have any questions, thank you.